This is our Bulletproof the Booty workshop. This is presented by Dr. Emily Roush and then myself, Dr. Ken Corcoran. So let's get it going. So ultimately, we want to know why you're attending. Like, why do you want to bulletproof your booty? So we would love to hear from you guys. Go ahead and chat in the chat box. What's going on that you guys are finding that you're having difficulty with, whether it be during a certain gym class that you're taking, or maybe just in general, maybe you're just not getting the activation, or you're not sure if you are activating those muscles effectively. Go ahead and type in the chat box, let us know, so that we can then tailor this to you guys a little bit more specifically and meet your needs. I know personally myself, I work with a lot of clients who work out at Orange Theory Fitness, and certainly who are doing a lot of functional high impact activities. So these are common things that we address on a daily basis. People who are having difficulty getting those muscles firing, therefore leading on more stress on their knees or back, and ultimately making more susceptible to injury. So we want to try to kind of address some of those issues and concerns and give you guys some good information today.
All right, so I am Dr. Emily Roush. I am the owner of Trinity Therapy and Wellness, and like Dr. Ken, we're both doctors of physical therapy. I provide private physical therapy to people around Charlotte in the comfort of their own home. I'm also doing telehealth in North Carolina and in Ohio, and just so excited today to be here with you all. Thanks for joining us on this Wednesday night, and I just really again, hope that you walk away with some good information, and we're excited to kind of tell you the things that we know from our health professional perspective.
As I've already mentioned, I'm Dr. Ken Corcoran, CEO, founder of Activade Heath, a mobile concierge PT practice, doctor of physical therapy, board certified sports clinical specialist, and a certified manual therapist as well. I've been practicing for over 10 years. And as I mentioned, I really work with that athletic population, so that's primarily my focus. And as Dr. Emily said, we're also providing telehealth services in this time of COVID-19. So, that's kind of who I am. So we'll get into it.
All right, so some of you have already kind of started to mention why you're here today, so thank you so much. It looks like some of you are having trouble just getting your butt firing. Some of you just want to know more, and then also just obviously bulletproofing that booty. So that's our goal today, right? Like, how do we do that and why? So first we have to know what we're talking about. So the butt is primarily made up of three major large muscles. So your gluteus maximus, your gluteus medius, and your gluteus minimus. So if you've ever heard like fire the glutes, that's what people are talking about. Primarily that glute max muscle is the one that's right behind your, like at the middle part of your butt. And its job is to bring the foot behind your hip. It also helps to support that low back. That glute med and glute min for short, it's really more on the side of the butt. So it's like that saddlebag. That's where you get that nice lift to your bum on the side and that nice shape. And its job is to really primarily stabilize the pelvis, especially when you're in a single leg kind of activity. And we'll go through some of those on the next slide. So how do we know, when should your butt or your booty really be working, right? Well, two big activities or functional movements really are a squat. So times that you use this would be, maybe you're bending down to pick something up. Maybe you have a kid that you're picking up. Maybe you're squatting heavy weights at the gym. For all you women, when we go into porta potties or to a gross bathroom right now, you're going to hover over that dirty toilet, right? Maybe you're a squatter to tie your shoes on. So this is something that if your butt's not firing correctly, if you're not really getting that glute max and medius, firing optimally, you might feel it in your low back trying to compensate. You might feel some pain in your knees as they're trying to overwork as your weight's shifting forward. And then especially single leg activities, right? So this is really where the butt comes into play. So single leg things you might not think of, right? Climbing stairs, running or walking, both of those are a single leg activity for a point in time. Kicking a ball with your kids, getting in and out of your car, especially if it's like a big truck and you have to really stand on that leg while you step up. Also maybe stepping into the bathtub. All of those are when you're on one foot. And so again, if your butt's not firing correctly here, you might have some hip pain. You might feel it on the inside part of your knee, maybe in that tricky part of your low back at that SI joint if you're not stable. So we'll get into a little bit more of those things that we as PTs look at, and then kind of what that means to you as the person. And Ken will go over those next.
Yeah, so these are some pictures we're just looking at to kind of highlight, if those muscles aren't firing accordingly, kind of how that may affect other parts of your body. So our body works together as a unit, and those larger, more active muscles tend to be the heavier movers. And so if your butt or your glute muscles aren't firing properly, then the strain gets typically placed up above or below. And so in this picture where you're seeing this gentleman lifting some weights up out of the ground doing a deadlift, he's getting a lot of rounding in his back. Typically, you'll see a lot of excessive forward lean as well. So he's going to be really putting himself in a compromised position and really kind of exposing him to lower back issues or lower back injuries. Taking that to more just common everyday activities, we'll see, for example, here, the woman carrying her child and several bags on one side and just completely contorted sideways, not able to really properly stabilize, in those single leg activity moments that Dr. Emily has spoke about, and where it's just walking or climbing up stairs. We need those muscles, those glute and hip muscles to fire to be able to kind of draw things in and pull it in so that we can straighten up. In addition to the core muscles certainly need to be active as well. But again, the whole body needs to be working together. And if not, then, we're seeing in this picture here how potentially she could be at risk of, lower back issues, hip issues, knee issues. And that certainly gets more involved as activities go higher and more complex. In the bottom left-hand corner, you'll see me doing a single leg stance. You'll see in the one picture on the right-hand side, me keeping my core nice and upright, be able to maintain that while I'm firing my glutes and my core. And then on the picture on the right-hand side, you'll see how I have a significant lateral lean, or lean to the side, if you will. And to kind of put it in different terminology, if you ever seen like an old lady walking down the street and you kind of see that waddle side to side, this is typically what her problem is, that she's not able to engage those muscles, or an old man, whatever that might be. But someone, if you've ever seen them waddle, that typically are having trouble firing these glute muscles to stabilize the hip. And as a result, they're compensating with that movement side to side at their back to kind of regain stability and to just kind of take that muscle out of it. So if we can get that muscle firing a little bit more, that's put us in more of an upright position. And then lastly, the picture on the right-hand side here, on the bottom right-hand side, you'll see two pictures of somebody going down into a squat. On the picture on the right-hand side, you'll see that we got good alignment with the knees kind of in line with the toe. You can't see from the side view, but I'm going to guess that their weight is more over the midline of their foot rather than way forward on their toes or back on the heels, losing their balance. Where on the right-hand side, again, this person isn't getting their glutes to fire properly, specifically that glute med or that side hip muscle that Dr. Emily spoke about. And as a result, we're getting a lot of collapsing in from the knee. And if you can get a perspective with that knee coming in, how that may be potentially setting this person up for knee issues, knee pain, or potentially foot and ankle issues. We can see a lot of kind of inward rotation at the ankle, therefore putting a lot of stress on those muscles as well.
All right, so the big question is, what do we do about it, right? So before you hit that, Ken, to press play, so the next couple slides that we're going to go through are really just setting the foundation of kind of getting that butt to fire, right? Because if you can't isolate it and can't fire it correctly in a small isolated position, then when you go to do that big movement like a squat, like he just showed you, or standing on one leg doing a bigger activity like running, right? You're not going to be able to hold it correctly if you didn't set the foundation for getting that muscle to fire, and you're likely going to compensate. So you can go ahead and press it now. So this one's really going over glute max. We're just going to take you through a progression of how we would get someone to fire that butt. During COVID, my roommate was moving out, so this is her empty room. And this is me. I'm just squeezing my bum. This is a glute set, so it's really just, can you get that butt to activate? This is a very great picture of my bum here. So I'm just doing, you can see I'm going to show you, try to do each side as well. So I'm going to try to activate one glute and then the other side, and then doing both at the same time, because sometimes you'll find that maybe your right one activates easier than the left, or opposite. The next option is to lean over something. So again, you're keeping the core stabilized, the back and belly stabilized, and you're just lifting that leg up to activate that bum. In a lot of exercise classes, you might be on hands and knees doing this, but if your core is not stable and that butt's not firing, you're going to really screw up your low back. So this is a modification of that, a starting point to get that butt firing for that bigger activity of hands and knees. And here too, we're just finding that. And then this is that further progression, right? So on hands and knees, if you can get that butt to fire, that core should stay stable as that glute engages. So you're not compensating that low back. So you're just stabilizing through the core, firing the butt. You can keep the foot on the ground. That's a great thing I have people start with, and then gently lift it up. And just really trying to, so that was what you don't want to do. Because that's what I see women do all the time. I didn't mention this before. I primarily work with women a lot of times for pelvic floor dysfunction. And a lot of times pelvic pain is due to people not being able to fire the butt and hip correctly. And it causes that instability at the pelvis and then turns into a pelvic pain issue. So if we can really get that glute max to fire, especially postpartum, when you've had everything shifting, can we bring it back and can we make it fire? And we'll go over that side muscle on the next slide of how to get that saddlebag muscle to come.
I just want to draw attention to one thing before I go to the next slide, Dr. Emily. In this last movement, we see how you extend your leg backwards, and then we get some trunk rotation. And I think that's a common misconception. People just kind of think, well, this is a pretty easy exercise. I can just lift my leg up pretty easily. But when we see that back extension, and I'll try to bring it back just a little bit here in this video. If I can get it right here. So here we see all this hyperextension of the back. We're getting pelvic rotation. So really the glutes aren't doing any of the work here. It's all really coming from the lower back, and probably the hamstrings are engaged a little bit. So we really, it's really important to kind of keep that spine and the pelvis really in a neutral position. So ideally a nice flat line across the back as she brings the leg back to avoid the back really doing the work and really isolating that glute muscle. So.
And that's the goal with these 2 slides, is to really, again, set that foundation for firing. So that way, when you do that global movement, you're not going to have that injury. So today is really, can we bulletproof that booty so that then you avoid that hip pain, low back pain, knee pain? You can go on, Ken, if you want.
Okay, let's try to get out of their full screen here.
And something with the glute set is really, it kind of went by quick, but again, trying to isolate it. Can you do both? So when I squeeze both of my cheeks at one time, watch my body in this film, I'm going to go up, right? And then if I just do one side, you might feel yourself lean to either side. So this is an easy one to do when you're sitting at this awesome home office desk during COVID. If you're out and you get out of your house and you get to drive, it's an easy exercise that you can do, in your car as well. So here we're going to really fire that glute med and glute min. Their job is to bring that leg away from you to the side, right? And they do a little bit of turning the foot in, but primarily it's holding that hip and pelvis stable. So I'm going to take you through a couple different ways to activate it. So the first one, the best one, I think, is the clamshell. It's rated one of the top exercises to get that butt to fire. However, you have to be super careful on how you do it. So you really need to stack that pelvis, roll the top hip forward. So really you think about that side of your hip. I always tell people, look at the seam of your pants and make sure it's, go ahead and pause it real quick, Ken. Make sure that seam of your pants is pointing up towards the ceiling and not pointing back behind you. So you really need to make sure you're in a straight line, and then as you start to lift that knee up, you should feel it. If you feel your hip, you should feel the muscle right behind it working. If you feel it in your hip flexor, then you're rolled too far back likely, and you're compensating with the wrong muscle. So the progression of this is to straighten the leg out and just do an old school Jane Fonda. She did it great in the 80s. We're going to keep it into the 2000s, right? You're just lifting that leg up and down. Again, you want to stabilize. You can play it if it goes. You want to stabilize through the core. A big one that I see here with people is they tend to shift the whole body as they go. And we really want it to just come from the hip. The next one, and this is one I love, it's an isometric, meaning we're just holding still and isolating a muscle. This is what we call the Captain Morgan without drinking, or you can drink while you do it, whatever. So you're just standing against the wall. You should feel this in both hips, so both butts. That's the motion we don't want to do. We don't want the hip to drop. We want to stand very tall, you're pushing the inner knee into the wall as the outer hip is also stabilizing your entire pelvis. So this is really a more functional foundational exercise that you're going into for like running, right? So this is upright on your feet. Can we isolate that muscle, get it to contract in this position? Do you have anything else to add, Ken?
No, I think that's pretty much it.
Okay.
So next we're going to go into more functional movements or dynamic movements.
And Dr. Ken will send you all a copy of this so that I know it's a lot of exercises that we're going to go through today so that you can go back and just really follow along on your own time to progress yourself.
So just to reiterate, so Dr. Emily kind of went through really some base level movements, how to get these muscles active, how to isolate these muscles, so that we can then take it into more dynamic, more functional movements that you may be doing in more of your high intensity interval training classes, like an Orange Theory or a Burn Boot Camp, so that we can now, again, take it from that base level, add it into a more dynamic movement where we're going to be more multi-planar, multi-joints, and just overall it's a higher level, more functional movement. So we're going to go through a progression here of a bridge, a side plank, a squat, the step up, and then a monster walk. So these may be some activities that you're familiar with if you guys are doing some of those high intensity workout classes on your own. Try that again. So here we're going through just a standard double leg bridge. We're bringing the butt straight up. Really important to highlight here just how I have a nice flat back, okay? We're not trying to kind of keep that butt sagging. We're trying to bring it all the way up high, getting the core muscles engaged. And we're trying to keep the weight more through like the middle of the foot or to the heel of the foot. That's going to help to get the glute firing a little bit more. If you feel like the weight is shifting more to the balls of the foot or towards the toes, then you're probably going to be engaging your quads a bit more. So be conscious when you're doing a bridge. Again, it looks like a pretty basic exercise, but if you're not getting those muscles firing the proper way, then it's just not going to effectively allow you to get the results that you want. So in a second here, we're gonna go to just a banded bridge. So now this is by adding in the band, we're still using those glute max muscles as our primary movers, but now we're kind of forcing those outer hip muscles, our glute meats, to be a little bit more involved throughout the entire exercise and workout. Then progressing into a single leg bridge. So again, just kind of taking it to another high level. We're really working on, again, getting the glutes involved. Core is going to definitely be more involved here because if you look at my hips, they're fairly level with one another, right? And if you put like a bar across the front of my pelvis, that bar should be level versus teeter-tottering to one side or the other. So if you're not sure if you're doing it properly, that's a great way to kind of get a biofeedback there or give you some sort of identify if there's any issues by just putting like a dowel or plastic rod across the front of your hips and seeing if you're getting that teeter-tottering side to side.
Real quick, Kate has a question and she says that she gets cramps in her hamstrings a lot with bridges, and if we have any suggestions on how to correct that.
Yeah, so I would probably just move your legs out just a little bit further away from your body. Again, kind of keeping the weight more onto the heels of the feet. And when you initiate the movement, really try to kind of squeeze the butt, or you can even do that glute set to initiate the movement by firing the butt muscles, and then from there driving straight up. Yeah, that's a common one. When you put the leg in a shortened position, a lot of times those muscles will start to cramp up. And I would just probably, if you do get that, just kind of get up out of the position, change positions, maybe stand up, allow those muscles to relax, and then try and reset and go again. But as you strengthen this muscle more and you're able to get these glutes firing, that's going to help to alleviate some of that stress that you're putting through the hamstring. Does that answer that?
I think so. She said thanks.
Okay, perfect. So now we're just going into a plank position. So this is our modified plank. A couple things I just want to draw attention to here. First of all, looking at my spine, how it's staying nice and straight throughout. I'm not getting any sagging of my hips. Also, I think I see a lot of people who do this where they, at their shoulder level, they're just getting like, and just kind of hanging out on the shoulder. Really important that you want to press through the shoulder. But getting into the glutes, again, if we see those hips start to sag down, then a couple things we're probably they're not doing is engaging the core or getting those glute meads to fire. And here they're not going to be certainly as involved as if we go to our full plank, which we'll see here in a moment. But still, I mean, this is a pretty high level movement if you guys aren't used to doing this. So again, just getting to our full plank position, and you can probably see me kind of swaying and struggling there a bit. Certainly higher level. Again, putting more strain on the core, on the glute muscles, and as well as on the shoulder to help stabilize. All right, so next we're going to look at our squat progression. So we're just starting off doing a basic squat to a chair. And I'll usually recommend this for my patients who really struggle with their squat mechanics, just because it gives you a great point of reference of where we're going to. Ultimately, a squat is just like you're sitting down to the chair, right? We're just being mindful of our body position. So maintaining a nice flat back, keeping the weight back a little bit so my knees aren't falling forward over my toes, weight pressure is coming straight down through my midfoot, and just maintaining good balance. As far as arm positioning too, you can keep those arms straight out in front of you, at the side, or across your chest, whatever you feel is more comfortable. Then we're just going into a deep squat. So now we removed the chair. We feel like we've got a pretty good sense of the mechanics there. So now we're just progressing it a little bit deeper, which is going to force those glute muscles to fire a bit more. Again, looking at the posture and the mechanics, keep a nice flat back, avoiding the knees going over the toes. And if you remember that picture back from previous slides, we want the knees to stay in line with the second toe. So if I drew a line straight down from my kneecap, it should fall over top my second toe. Those knees should not be collapsing in. And then progressing into our step up. So again, we talked about our single leg activities. So if you're not, used to doing step ups without a railing or being conscious of your posture, things to be conscious of are certainly your pelvis. So you want good pelvis stability. So hips are level. You shouldn't see any sway side to side. This is a single leg progression. So now I'm stepping up with one leg and then bringing the other leg up and pausing. So it's going to be a little more challenging from a balance perspective. So really kind of drawing in those muscle groups in the core and the glutes, really all the way down through the leg, the knee, hip, and ankle as well.
And I think here too, something to mention is that all of these that he's done so far with squats, not only is the glute max and the butt working on the way, it's working on both motions, on the way down and the way up, right? So when you're coming down into a movement, that muscle has to be strong as it stretches and lengthens. And then as you're going up and it's contracting, like when you do a bicep curl, you can see the muscle. That's when we're going up. That's when that muscle's shortening and contracting. So it's a big deal to make sure you're going slow through the movement, because it really helps to accentuate that eccentric or that lengthening strength. Ken, Erica has a question. When squatting, which stance widths are best to activate the glutes?
Yeah, for glute activation, I like to take just normal athletic stance, feet shoulder width apart. I don't want to be like over spread out with my feet. If I'm doing like a real heavy lift and I'm just going for how much weight I can lift, I can take a wider stance, more of like a sumo stance or a sumo squat, if you will. But in that perspective, you're probably using that structural support from your joints more than you are from your muscle activation. And guys, I just want to draw a note. We may get bumped off this meeting. Our meeting might be ending in 3 minutes here. So if so, again, just log back in and we'll hop back on with you, okay? So I just went through a monster walk progression. So you saw on the first one, a lateral monster walk. So that's going to really isolate more of those lateral hip muscles, while also, kind of drawing in the core muscles. So if you kind of being redundant here, you can hear a lot of core activation as well as glute, because these joints are so closely associated. They're really working together in a lot of these functional movements. And if I can take this back for just a second, I just want to highlight how I had to draw my knees out just a little bit for these monster walks. So,
Yeah.
The band's pulling you in, you're trying to work your resistance against the band. So I'm drawing in my core and pulling my knees out there to kind of activate those muscles. And so once then I activate the glutes, trying to hold that and sustain that as I move forward. So the knees shouldn't be sweeping in. I know some people will show it sweeping in and out. I like to have more of that like steady contraction, which I think really kind of activates those muscles and burns the muscle out faster and gets you to that point of fatigue, which is going to allow you to develop muscle faster versus just kind of sweeping in and out motion. So we can do that in our side stance as we did before, or just a forward monster walk as you see here. And again, if you see my spine, trying to avoid any significant sway right or left, just trying to keep a nice upright stance throughout.
All right.
Just trying to advance our slides here. I think I'm froze from our videos.
Okay, I'll talk.
There we go.
So, we went through a lot of exercises, right, for the butt, but the biggest thing is like, why do we need good glute activation? And I think the biggest thing here to know is that we really need to get that butt firing so we can prevent injury, right? Because if it's not firing correctly, more than likely you're going to be compensating with something else, whether that's your quad, your hip flexor, your low back, whatever. It also just provides stability for that entire pelvic hip girdle. So just to really get that butt firing can really help to aid in prevention for any kind of, well, I guess that's the third one, reducing your risk for injury. And then also, kind of like Erica said, she wants to make sure she's optimizing her exercise time. As long as you're getting that glute firing correctly, then, it'll really help with that, physical performance. I can't even talk today. Sorry. But again, I think starting at the foundation so you can really start isolating the muscle first and then growing it to a bigger activity. So even if you're doing big activities right now, take a couple minutes each day to do those first level isolations and see if you can find it really firing between the muscles, right? Can you activate just the glute max? Can you find that glute med and just fatigue those versus doing a big activity that's going to hit both of them at one time? So give yourself some grace, right? This is a lot to think about, and it takes a good 8 weeks to build solid muscle strength, to really get a change in the muscle strength. After 7 to 10 days, you might feel a little stronger, but really it just means your nerve is firing better. But to really change the physiology of the muscle, it takes about 2 months. Also, give yourself some time, because if you're doing something incorrectly right now, it's going to take you almost a month to create a new habit on how you're doing it. So it's just a matter of continuing to check in on yourself. As you're squatting, think about those things we talked about previously. Are my knees falling in? Do I feel my butt activating, right? If I feel it in my knees and my back, I'm not doing something right. So I need to go back to step one. So if you still don't feel like your glutes are firing correctly, or you are still having that pain, maybe this is a time where you need to reach out to someone and ask for a little bit more hands-on care, some professional help. And Ken and I are very much open to doing that for you all. Sometimes it can be just a quick fix. I think sometimes too, creating that stability through the core and through the breath to also get the hip to fire is a big issue that people have.
So ultimately, guys, we just want to certainly let you know that we're here for you to help you out with any questions or things that you might be having difficulty with. Maybe it's not even related to just your glutes or your glute activation, but maybe it's more of like those functional activities that you're doing. And you're just finding like, am I doing it right? Am I not doing it right? So we want to offer you guys an opportunity to sit down with us for a free consultation. And what that looks like is about a 20-30 minute conversation where we can kind of discuss your specific issues, your specific concerns, and then from there kind of outline like what a treatment plan is that we could offer you guys, and how we can help you out. So I think it's a great opportunity. Like I said, it's free. There's no commitment, no requirement. So if you have some additional questions or concerns and you're not sure, is physical therapy right for you, or, is this an issue where you need to work with your trainer, we're happy to kind of assist you in that decision-making process. And these consultations can be scheduled either in person, or we can do these via Zoom or over the phone, whatever works best for you guys and is most convenient, certainly. And with that said, we just want to open it up to you guys with any questions, or if you have any comments. We'd love any feedback that you have for us. Please feel free to share. I'm going to try to get my chat box open so I can see that in. And if you guys don't have any questions, we certainly thank you guys for joining us today in this meeting. I will email you guys the recording from this, so you can always go back and you can see the exercises that we reviewed today. And again, if you have any questions on those exercises, please don't hesitate, reach out. We love what we do, and that's why we're putting these on for the public today. So
yes, thank you so much.